In our topic, we will be discussing whether vitamins are healthy or if they are toxic. The findings leave many people wondering if taking a daily diet supplement is a good idea. One study found that older women who take daily diet supplements of iron, copper, magnesium, and other vitamins face a slightly higher risk of death than women who did not. Researchers at the National Cancer Institute published another study linking daily intake of vitamin E to 17% greater risk of prostate cancer. So, should people really be taking vitamins? Experts say some people should, like pregnant people or people with specific vitamin deficiency, can benefit from adding vitamins to their diets. However, our bodies need many different vitamins and minerals to function properly. Vitamins and minerals also offer us protection against a host of ailments, including heart disease and some cancers such as colon and cervical cancer. The good news is that we can get most of our vitamins and minerals our body needs by choosing the right foods and eating a wide variety of them. Still, many people take a multivitamin daily as an insurance policy, just to be sure they are getting all the vitamins and minerals that their bodies really need. Vitamin supplements can be particularly important during certain stages of our lives. For example, women in their childbearing years benefit from folic acid, which decreases the risk of some birth defects. A pregnant woman needs a multivitamin starting in the first trimester to ensure what the baby receives proper nutrition. Active and older women can benefit from increased calcium, which can help prevent bone loss and fractures. Vegetarians can also benefit from taking extra calcium, iron, zinc, and vitamin B12 and D.
Beginning of the 16th century, the ancient Egyptian had a practice on feeding liver to a person who helped curing the night blindness. In 1953, Scottish surgeon James Lind published his treatise on the scurvy, in which he found that lemons instead of limes does have more cure on scurvy disease, which was accepted by Royal Navy. So from the late 18th and early 19th centuries, they have been studying and have done more researches related to vitamins. In 1884, the Imperial Japanese Navy observed the endemic spreader on low-ranking crews called beriberi. With the support of the Navy, a British-trained medical doctor, Taka Kanshiro, experimented with two crews of the same battleships. He fed a diet of meat, fish, barley, rice, and beans to one crew, and the other crew who ate only rice. He found that 161 crew members who ate rice only were affected with beriberi and 25 crew members died. But the later group, only 14 cases affected with beriberi and no deaths were found. He came to the conclusion that diet was the cause of beriberi, but he had mistaken sufficient amount of protein can prevent the disease. It was further investigated by Christian Eichmann, who discovered that eating unpolished rice is more effective than polished rice. In 1906, English biochemist Sir Frederick Garland Hopkins also discovered that other than proteins, carbohydrates, fats, etc., are necessary for the functions of human body. Finally, in 1929, Hopkins and Eichmann got the Nobel Prize for Physiology or Medicine for their discovery of several vitamins. In 1912, Polish scientist Kashmir Funk named the special nutritional parts of food as vitamine after vitamin life and amine the compound in thiamine that isolated from rice husks. Vitamin was later shortened to vitamin, that VITAMIN. Hopkins and Funk formulated the vitamins hypothesis of deficiency disease, which could make the people sick because of the lack of vitamins.
So, what we will go over today is the essentials of vitamin supplements, how many is too many vitamins, the side effects of vitamins, and to prevent primary diseases.
Now we are going to look at essentials of vitamins. Vitamins do not share a common chemistry, but they do share certain characteristics. There are 13 known vitamins, of which 4 are fat soluble and the remaining of 9 are water soluble. The fat soluble vitamin is absorbed with the help of fat A, D, E, and K, which are fat soluble. And 9 water soluble vitamins are B1, B2, niacin, folic acid, B6, B12, pantothenic acid, biotin, and vitamin C. So, who should take vitamin supplements? About 30% of Americans take at least one vitamin supplements or mineral supplements every day. Pregnant women with healthy diets may have low folate levels and they need to take supplements. Human milk has low levels of vitamin K, and newborns' immature intestinal tract may not produce enough of the baby's own supply. So, the infants being breastfed by malnutrition mother, women, or those who lack sufficient exposure to sunlight may be deficient in vitamin D. In these cases, supplements of 200 to 300 IU may help them. Alcoholics have to take the vitamin supplements. The most dangerous deficiencies are in vitamin B1, folic acid, B6, B12, and vitamin C. Low levels of B6 are associated with increased risk of colorectal cancer in men who drink large amounts of alcohol. The people who have gastric bypass surgery have to take or complication of gastric bypass surgery. It can be treatable with water soluble vitamin supplements. The strict vegetarians also need to take supplements of vitamin B12. The dieters, vegetarians may need riboflavin, vitamin B12, and vitamin D supplements. The older adults, elderly people often skip their dietary habits and fail to eat balanced meals regularly. If they are not exposed to sunlight, may get deficiency of vitamin D. So they also may have low levels of important B vitamins. Vitamin E also benefit their immune system. People who avoid sunlight, whose diet is low content of vitamin D, darker skinned people should take vitamin D supplements. So totally it is beneficial and essential for growth, bone development, vision, reproduction and health skin.
How much is too many vitamins? Often people say too much of a good thing can have an unexpected consequence. Just ask the people who gulped on gallons of carrot juice, which is rich in beta carotene, only to find that the palms of their hands and the soles of their feet turn a dull yellowy orange. So, for overdose of vitamin A can lead to liver damage, headaches, blurred vision, and even hair loss. For overdoses in vitamin B6 can cause numbness in the mouth and hands and difficulty in walking.
Yet, even though multivitamins have many potential health benefits, certain side effects can occur through improper use, allergy, or intolerance. I will discuss some of the serious side effects, mild side effects, and allergic reaction side effects. Many of the most serious side effects of taking multivitamins results from vitamin overdose due to ingestion of too much of the given mineral. Calcium, iron, and zinc are all necessary for the human body to function properly, but too much of any of these minerals in the bloodstream can lead to serious complications such as heart palpitations, stomach bleeding, confusion, tooth stains, and increased urination. Even more serious is an overdose of vitamins A, D, E, or K. A serious overdose of these vitamins can be even life-threatening. Early warning signs of vitamin overdose include weight loss, splitting headache, menstrual changes, intense back pain, or easy bruising. While it's possible for someone to overdose on a relatively small amount, the chances of overdose increase with the amount of multivitamins taken. Just because one day is good for you, don't assume 3 a day must be better. It's not. Some of the side effects may include multivitamins taking on an empty stomach can lead to gastrointestinal disruptions, including queasiness, constipation, and diarrhea. Other common but less serious side effects include slight headache and a lingering foul taste in your mouth. The foul taste is more likely if you take your vitamins without food or don't swallow them fully. Multivitamins can also cause sleep problems, especially if taken right before bed. To reduce the risk of unpleasant side effects, take your vitamin in the morning with breakfast or in the afternoon with lunch. It's most important to take your vitamins with the meal. Since multivitamins contain so many vitamins and minerals, allergic reactions are certainly possible. Mild allergic reactions can include itchiness and few hives. If you experience these side effects, stop use or contact your physician immediately. You should experience more advanced signs of an allergic reaction or anaphylactic shock, such as trouble breathing, chest pain, widespread hives, or a swollen facial region. Visit the closest emergency room immediately and contact your doctor immediately. Although it is important for women to take their multivitamins, pregnant women attempting to get pregnant and nursing women should not take any multivitamins that contain more than 100% of the recommended daily value of these vitamins and minerals. If you are pregnant, discuss with your prenatal vitamins with your doctor. If you have any other issues, please consult with your physician immediately before intaking any of these multivitamins on a daily basis.
From our reviews, the studies have shown by taking vitamins have reduced 1. Cardiovascular mortality risk, 2. Reduced the risks of cancer, and 3. It also have been experimented with women who are infected with the HIV virus, and the results have shown the long-term in taking multivitamin delayed the virus infection and had greater lifespan. Some of the reviews has shown the results as non-essential by experimenting with athletes, which had given significant change in the oxygen consumption, maximum heart rate, peak blood lactate concentration, and any time during the study. Toxications of vitamins are like diarrhea, nausea, vomiting, visual, hair and skin color changes, fluid deposits on brain, and calcium deposits on kidneys. And taking high doses of an antioxidant vitamin, especially beta-carotene, are harmful to smokers.
30% of Americans are in fact taking vitamins. According to many researchers, multivitamins are important in life, but doctors should take attention onto their patients and recommend which essential vitamins are best and suitable for their patients.
A special thanks to our crew members,
Philip McFarlane, Padma Mylapur,
and Nicole Surik.